what are best-in-class employers doing today around mental health? We've talked about it about a month ago. One of the best silver linings of this pandemic is the intense focus on mental health and taking care of our people. But what does that look like?
Yeah, that's an excellent question, Justin. I think if you think about how the pandemic has shaped the employer-employee relationship in the last, 2.5 years, you would notice that a lot of the employers have realized that the traditional methods of how they were catering to mental health is not really working, especially with the big movements around things working from remote, people doing resigning from their opportunities, not just not just for the reason that they have another job, but just for the reason that they want to do something else and find purpose in what they do. So things have been very different in this 2.5 years. So traditionally, a lot of the employers have employee assistance programs, which are called EAPs, which are typically pretty low cost uh, avenue for employers to offer their employees on how to get mental health support. The problem generally with those traditional methods, it's pretty transactional. And especially in the US, it is very much around uh, putting the onus on the employee to find care, which is not necessarily the best way to do it, because you're basically saying that, hey, we have an EAP here, we have some access to some psychiatrist and therapist, and go figure. So that's not the best model for employee productivity and showing that you care. So most of the progressive employers are now moving towards, like, how can mental health be something that is more weaved into the benefits they offer to the employees, and that is caring for the entire whole health of the employee. So think about like medical benefits, dental benefits, pharmacy benefits. So how can mental health be something that is uh, part of an employee benefit, where they not only have access to the world-class providers, but also there is a relationship that they're building in terms of realizing how much mental health matters. And today, I think most of the employees who have gone through this pandemic in 2.5 years have realized their different needs. Some person might be really anxious about how they want to grow their career, and they don't know. Now this is a new world, and they might be struggling to adjust to that. Some people have found tremendous issues in terms of finding childcare. So that has really affected their mental health as well, in terms of uh, doing their best at their work. So most of the progressive companies are moving more towards looking for solutions that comprehensively takes care of the employee, and not a transactional basis like it used to be.
Right. Right. And a couple of things that I want to reiterate there. The big thing to me, the difference of a traditional EAP, employee assistance program, you said people are often left to figure it out on their own. And I think increasing the accessibility for people is so key. I mean, we have Gen Z and millennials who would much prefer to text. And I'm seeing that as texts and chats as a more accessible way to connect with more people, in addition to the traditional formats of calling in and now zooming in as well. So I'm curious, Showman, when you talk about this comprehensive solution, what is that often pieced together by companies? Is there a more robust mental health resource and also a child care solution that's there to help employees, or how do we bring things together?
Yeah, excellent question. So I think other than the formats that you mentioned about text messaging, other avenues for employees to be able to connect to their providers, I think one key aspect missing with EAPs was also, how does an employee know that they need help?
Hmm.
Like, how would they know that they need a psychiatrist versus a therapist versus like a mental health coach, or a regular coach, or just maybe they need just a self-guided digital access to meditations and things that you have seen from B2C companies like Headspace, Calm, and others. So that was missing in EAP too, because EAP is basically saying that we have these providers go go talk to them. But most people didn't know what they need help on. So in many cases, there are literature that are saying that people are trying to go to a therapist or a psychiatrist and then realizing during their sessions that that is not exactly the right care that they were looking to get. And it is more around maybe coaching, like somebody, as I mentioned earlier, that somebody is anxious about their career. It's probably a coach that can help. You don't need a therapist in that case. So so I think that comprehensiveness, bringing in the awareness that what kind of care is best suited for you, who should you connect to, are they the world class providers that you're connected to, and hey, in between your sessions, you should still do these few meditations, a few of these courses that will keep you going, because that's another thing missing. You go to a session on a therapist today, you meet with the therapist next week, but what happens to the in between? So I think that's where the comprehensive nature of the mental health solutions are coming out. And you mentioned a little bit about the childcare situation. So many of these, uh, I would say in the industry, things are moving more towards how do you now think about the mental health not as a standalone solution, but how it actually impacts other aspects of a member. So think about the literatures that are out there, which will say somebody who is diabetic or dealing with musculoskeletal issues like back pain surgeries are 3 to 4 times more likely to have depression. So, which means that it's not a physical medication on back pain that can solve the problem for that member. It's actually a combination of how do we help them with behavioral aspects. And that's where the comprehensiveness of this thing is coming in. And then we can talk more about like family benefits. That's another aspect of, growth that I'm seeing also in the industry.
Yeah, and Showman, before we go into the family benefits, because I want to go there, I'm curious. Let's take a step back, and I want to try to insert a practical, immediate takeaway for listeners. And you mentioned meditation, and there's so many apps out there now. When you think of mindfulness, meditation, be curious to pick your brain. What what works for you?
Yeah, I think it is a I would say it is like a journey to me personally. If you ask me like what works for me and what has worked, so many of these apps have different sorts of meditations, whether it's related to anxiety and depression, whether it's related to more mood elevation. There's a lots of different things you can access. I think most importantly, many of these apps historically have missed out, and now most of the modern solutions are coming out with these, is helping people realize what how should you leverage or how should you gain the most from meditation. How should you think about it? Like, what are the feelings you're going through now that you can describe, and then kind of chart your own course or have your own care plan that what will work with you. So in many cases, for me, let's say talk to a therapist, and I will be discussing things around. We will be unpacking a lot of different things in our discussions, and one of the things that my therapist can help then is what are the kinds of meditations that will help me stay focused. So in that's another thing that was lacking with some of these apps, because there's so much content there, and every day there is so much content that how do you know what is more relevant? In fact, I would say people get even more overwhelmed when they see so many meditations. So how do
Right.
you like make sure that people have more personalized care plans that work for them? And I think that's the combination of really having the human, like a therapist or somebody, to support you along with the amazing content that's out there. A combination of that helps you keep going. does
Yeah.
that does that help?
It does, and thank you for being vulnerable and sharing with us. I love the idea of it being a journey, because I think that just reiterates that a lot of times we live in this instant gratification world, right? We can get something mailed to us the next day, 2 days at the max. And if we want something, we almost feel entitled to have it right away. And that's not the case. And I appreciate you reiterating that much better than I could, because I feel the same way. It's a constant journey. And when it comes to, I think of a coach I have one-on-one sessions with. It's more of a therapy session is what it feels
Right,
like.
right, right.
But regardless of whether the title is coach or therapist, the point is that you're working on yourself, and I think that's so important. So thank you for sharing that. And then I do want to jump into family benefits. So first, when I think of family benefits, I think of what my family might need outside of the basics, like medical, dental, and vision. So a couple things that come to mind are like, what if I have an elderly parent that I need to take care for, or kids? Like, what if I need care for my kids? So can you expand on what family benefits are and what you're seeing out there today with employers?
Yeah, that's another big space I would say that has been that has been very clear for employers in this pandemic that families need help. And when I say families, I don't mean just couples. I mean anybody who is thinking about their parents, or they are thinking about their uh, adoption, surrogacy, all of these other avenues. And I think the gap that has always existed, which wasn't visible before the pandemic, was how much onus it is on people who are raising kids or thinking about kids, what matters in terms of their day to day. And when the pandemic hit, it was very clear that there was no childcare because there was COVID. So nobody was able to get that support. People then had senior family members like their parents or somebody else in the relatives who are now very vulnerable to COVID and the mortality that it was bringing to those senior citizens. So I think it was very clear for employees that the employee productivity was dropping, especially with the family population, because they had to do so much and they didn't know where to go. So I saw in the last 2.5 years a lot of movement around the family benefits that included things such as, if you're thinking about surrogacy, about parenting, you need somebody to be by your side. It could be a postpartum doula, it could be a lactation expert, it could be a sleep expert, it could be a couples therapist, whoever it is who's helping you cope through that moment, like whether you're pregnant or you are having a very young child. So, as I think there's a very famous phrase that it takes a village to raise a child. It's pretty much that, because it's between doctors' visits, medications, and things. You still are coping with how to raise the child, whether the child is from adoption, surrogacy, and your own birth. So, how do you now deal with that? So you need, like, a lot of the employers have realized they need support systems for these families. And then there's another aspect of families, which are typically, I noticed in the demographic between the age of, I would say, 35 to 50, who have who are what is famously also known as a sandwich generation, where they have senior citizens who are 70 and up they need to take care of, but they also have kids they need to take care of. So they're kind of like sandwich between taking care of two different generations. So how do you kind of manage that aspect of doing? So a lot of the employers or progressive employers are looking towards not just providing medical benefits or dental benefits or child adolescent sort of benefits, but they are looking at comprehensively thinking, how can we support that family with all this? So they are partnering up with a lot of child care institutions, like I'm forgetting the name, but I think Bright Horizons is one of them. That and then they are also partnering up with a lot of these networks of postpartum doulas, lactation experts, sleep experts, and then they're partnering up with elderly services, which are also needed, so they can bring that comprehensively to the employee. Unfortunately, right now there is not one family benefit that brings all of this together. So it's still a combination package that employers are dealing with, but I think that will change soon.
Yeah, yeah. Thanks for sharing that. And a couple of things that come to my mind. I love the idea of it takes a village. I think that's so true. I was just back in Ohio with my nieces and nephew, with my sister, and my goodness, I think without my mom being around to help and my dad being around to help, who knows what she would do on her own. And I think to your point, it's team, right? It takes a team. It takes resources. It takes hands-on help and care for both the elderly and the younger generation. I'm wondering, Showman. Well, maybe I'll just say for listeners real quick, if you want to tell your employer, ask if they have these things and they don't, then reach out to Showman and myself, and we can help connect you in the right places. I think it all starts with conversation. Generally, my clients come to me and they're like, "Hey, can we do something around fertility planning?" And I'm like, at one point I said I haven't heard of this, but we'll look into it. And it all started because one employee asked, "Hey, can you provide us with some more resource in this area?" And I think, Showman, what's cool is that many progressive employers want to take care of their people. And that's really favorable with the tight labor market right now. Employees have power to certainly at least ask.
Yeah, absolutely. You're spot on.
Yeah. And so as we transition here, Showman, I want to. I know you have a lot of experience with product management, and that's becoming an ever more popular, I would say, job in just industries, product management. Could you expand on that a little bit for our listeners?
Yeah, I think product management, I think also as it is evolving, it depends on who you ask what they do. And there are a lot of, I guess, content around what is product management. So I won't get into all those details. I think I'm sure your listeners have seen those contents. The few things I'll highlight from my experience, which I've learned, is product management depends on which kind of space you're working in. So let's say you are in a B2C world where you can think about companies like TikTok or Meta or anybody else. They are really focused on a very different skill set for a product management, and there's a lot of materials around that on how product management is through direct to consumer sort of a business. Then there is a concept of business to business, which is a company selling to other businesses. So these are kind of products you would see in Salesforce, and you will see in some of these other ones like AWS and others. So how do you kind of understand product management in that space? In B2B, just for the listeners, this is very unique. Is that B2B also has variants within them. There are B2B businesses which are pure software. So you'll think about SaaS. So companies like PagerDuty might be just, it's all about the software they're selling. Salesforce is a good example of that too, with the CRM offerings or HubSpot and others. Then you take a look at um, industries and how they change in the B2B offering. You come to healthcare, and then you are starting to look at the fact that it is not just the software. There is a big component around clinical care. So think about Teladoc or think about like these bigger telehealth platforms. It's not just the platform that has come together. Three different areas have come together. One is the clinical part, like who are the providers on that platform? How do you make them motivated to be on the platform to support the members? Then you see another aspect, which is the software itself. Like you have built the telehealth software to bring all these providers together, created a marketplace for members to come in. And then there's a third aspect, which is operations. So if you think about, for example, in traditional provider availability, I know like personally, I tried to get an appointment with one of the doctors and it was two months out. And I was going for my kid with, having some flu-like symptoms. I'm like, I can't wait for 2 months. So imagine that, right? So how has telehealth changed that? Telehealth, I can go into and log in and find a provider right away, anywhere in the US, right? That's operations because they have now reduced that time to care to within minutes compared to like waiting for an appointment, going there, waiting, all of that. So these three things come together in that space. Now you can think about companies like DoorDash, Uber. They're not just software. They also have massive, massive operations part, onboarding drivers and things like that. So B2B should be thought about. So product management differs on which areas you are in, but ultimately you need to understand the business you're driving and how can product management elevate that level for the company to really leverage all the efficiencies you're gaining from all these services like operations, clinical, and others. I'll stop there for a second. I know like there's a lot of other materials out there, so I didn't want to go into that, but this is pretty unique enough when you start thinking about B2B or B2C product management.
Yeah, Showman, I think that's great and certainly a good baseline. I wanted to bring it up, one, because you mentioned it, and two, because I've had some listeners ask, like, hey, what do I know about product management? And I'm like, nothing. I don't know anything. It's not my world. So I think that was great. I want to ask, what about, do you see what Teladoc has done in creating more accessible medicine and healthcare? Do you see that being replicated into other industries? And if so, what comes to mind as an industry that you think might be revolutionized, if you will?
Yeah, I think there's a lot of different industries where Teladoc has created a platform that can bring it. Things like I don't know what the right term for that is, but if you think about like contractors when they're working on your house or wherever you are and you need to work, I mean, it's very hard to find a good contractor, as everybody has gone through. So what if there's a platform that actually allows you? I know there are companies like Thumbstack, or I'm maybe misspelling them, but there are some companies who have tried that, but it's not yet at the level that health tech has innovated, like in Teladoc and others, where you can solve that for a member. Um, yeah, I mean, I think that's one that clearly is top of mind for me. That seems like a good platform to have. And then there are a few other industries too, where you would think there are inefficiencies in how you're finding the best quality work, and you can bring them together. So I think we have seen that from past experience of Uber and DoorDash and others who have done that in other industries. But yeah, there's lots of industries that can be applied.
Yeah, so ever increasing opportunity.
Yeah.
Thank you for that. And Showman, with that, we're wrapping up what I wanted to cover for listeners. So I'll ask you, do you have any final words that you'd like to share?
Um, and first, thanks for having me, Justin. I think if there are a few things I would like the listeners to consider is essentially always keep yourself curious. I think that's the growth mindset one we need to have. And listening to Justin and all his podcast, personally, I've seen is there's so much to learn. I think keep learning, and that's the only thing that'll keep you going.
Keep yourself curious. I love that. Showman, thank you so much. We'll put how to connect with us in the show notes. And outside of that, have a great day, everyone.
Thanks, Justin.